Happy Friday. Happy Friday Facts. So excited to be together. It is June. It's our first Friday Facts of June, and we have two big awareness months. Our focus today, June, is Alzheimer's and Brain Health Month. And I'm absolutely thrilled to have my new best friends as of 5 minutes ago from UNC Neurology, but we've had fun for months planning for them to come on. And I'm so excited to talk about their work in the brain health space and all of the great resources. June is also Pride Month. And so that is my way of reminding you to join us for the next Friday Facts, which will be June 28th. We're going to have Jacob Gordon, our own coalition member, talk about his work with Trellis and also about his work within the LGBT community. And we'll do a little Pride celebration later on in the month. But for now, my only last reminder is next week is our monthly meeting. So please, for those of you who are coalition members, remember next Friday from 11 to 1. And those of you who are joining us today, no cost to join, and fabulous folks like this coming together to talk about how we advance support for those with serious illness, programs and policies and providers. So we have a monthly meeting the third Fridays of the month from 11 to 1. And we have a great topic looking, Anna Pardo from the North Carolina Justice Center is going to be talking about caregiver workforce policies. All right, I got to stop talking because we've got like double delight today. We've got two amazing speakers and new colleagues that I'm warning you now, colleagues, you're now a part of the coalition, and we will keep you. They've already been helping behind the scenes with different topic areas. So we have Sutton Salinger and we have Dr. Andrea Bozoki. Dr. Bozoki is the division chief and professor of memory and cognitive disorders at UNC Neurology. She's also the Outreach and Engagement Core Leader of the Duke UNC Alzheimer's Disease Research Center, and you'll hear all about that. And Ms. Salinger is the Community Engagement and Social and Clinical Research Specialist in the UNC Neurology Clinical Trials Unit. So excited to have you both here and to enhance our brains with your work and your experiences. First of all, welcome to both of you.
Thank you so much. I'm delighted to be here this morning.
Yes. Okay. So we have a tradition at Friday Facts, which is before we dive into all the work excitement, we want to get to know a little bit about each of you, where you're from, and how your pathways brought you into the brain health world. So let's see. Andrea, do you want to start first?
Sure. It started in college. I read a book that happened to be a bestseller at the time, The Man Who Mistook His Wife for a Hat by Oliver Sacks, who was a behavioral neurologist and wrote about his experiences in caring for some unusual neurologic patients. And I fell in love. I thought this was the most incredible, amazing thing that I could study in life. You know, how does this wetware in the brain turn into all of the feelings and behaviors and thoughts that we have as human beings? And that was it. I went to medical school. I chose a residency program and then did a fellowship, all in order to follow this dream of doing what he did. And I am really happy to say that all of these many years later, I have not regretted my choice. The brain continues to be the most fascinating both organ and microcosm of the universe that I could find.
That's amazing. And what an interesting origin story. It gets me thinking I should read more, but okay. But I did want to ask a quick follow-up because you and I talked right before we started. I didn't catch your awesome term, behavioral neurologist. And so really quickly before we turn into Sutton, I see you, we're coming to you next, but how is a behavioral neurologist different than a not behavioral neurologist?
Sure. Neurologists, as many other professions in medicine do, we can choose to subspecialize after we finish our initial training regime, which is called a residency. And 100+ years ago, when neurology first split off from psychiatry, really almost all of neurology was essentially behavioral neurology in the beginning, following the path of people like Freud and Charcot. Uh, so behavioral neurology is the study exactly of what I described, brain behavior and brain cognition relationships. And, our approach is a little different from psychiatrists traditionally in that we are really interested in neuroanatomy and neurophysiology. We really care about truly how does the stuff in the brain turn into these things that we describe as behaviors and thinking. The term could just as easily have been cognitive neurology, and in fact, lots of us actually add that. We say cognitive behavioral neurologist.
Oh, I want to have a whole show on that. I've got like 10 follow-up questions because I'm fascinated, but I will not ask it now because right now we want to learn about Sutton, and then I know we're really going to be focused on some of two specific programs, but there's going to be a whole other Friday Facts on that sort of behavioral work. Okay, Sutton, who helped to put this all together. Thank you, Sutton. Tell us about you.
Yeah, well, first I just want to say thank you again for letting us be here. It's really exciting. I'm originally from Wilson, North Carolina. The accent is going. It's been a long time since I've lived there. But how did I get into brain health and all of that? Growing up, I worked at a crisis center for my aunt. They had a program called Hello Calls, which were to remind our elderly citizens to take their medication. So I had a lot of interactions with people in the early stages of dementia that were housebound. So it started kind of sparked that interest in elder care and community outreach. And from there, through a bunch of years and a bunch of different career changes, I got my master's in public health with a focus in behavioral science and health education, which is basically why do people act the way they do and how can we educate them so they can be as healthy as they want to be, whatever that means to them. And found research through grad school and have loved it ever since. So it's how I got to UNC and the NC Registry for Brain Health. It kind of melds those two loves of outreach and education and research.
Well, you don't know this. You and I have the same degrees, the same MPHs from the same department. So you and I will have some fun afterwards. I do want to do a quick shout out as a gratitude of my colleague Steve Hahn is on from AARP. And Steve is the one, when Steve and Connie were thinking through with our coalition work group, what would be a great Friday Facts topic. And so Steve connected us all together. And so, okay, how do we want to start real quick? We want to talk about your work within UNC Neurology. Do you want to talk about your work in memory and dementia and brain health? Do you want to go right into the NC Registry for Brain Health? How do you want to, Andrea, give us a quick, I hate to rush you all, as an umbrella of the work that you do at UNC Neurology and how it links into, I know, two big initiatives we want to talk about.
Sure, yes. I wear many hats at UNC. I moved from a long career in Michigan down to UNC right in the unfortunate year of 2020. I had been for some time sort of searching to make a change from what I had been doing as a professor at Michigan State, and a colleague and longtime friend invited me to join him. He was the prior behavioral neurologist at UNC. His name was Daniel Coffer, and to my everlasting sorrow, he became terminally ill as we were making plans for me to come and join him. A really sad time for me in 2020, both for the obvious reasons and because by the time I arrived, in order to, join him in partnership and develop this division, he had passed. So I ended up taking on some of the responsibilities and torches that he had carried. And I have found a passion in caring for individuals with unusual forms of dementia. Not only do I care for people with Alzheimer's disease in the clinic, but also those with Lewy body disease, with frontotemporal dementia, with vascular dementia, with normal pressure hydrocephalus. There are many other, unfortunately, forms of dementia beyond Alzheimer's disease. And some of the research work that I'm pursuing now directly relates to those uncommon forms of dementia that I see in the clinic. And I also serve as the division chief, the role that he had before I arrived, which simply means that I lead a small group of folks who are as dedicated as I am to the care of individuals living with memory loss or other forms of cognitive decline.
You do such amazing work, and I work privately with clients, many of whom I have a whole other side thing working with individuals with dementia, and gratitude to you. And those are the most complex. And you mentioned something, and that I think is really exciting, especially for us as a coalition, which is, it sounds like, and I don't know what the balance is between your direct care work and your research work. And I know for us as a coalition, as advocates, we're both into what's happening day to day and the provision of services, but also kind of big picture, what are we researching and able to impact the future. So I guess if one of you wants to, I want to dive a little bit into the research, or if there's things you're learning in the direct care that can provide a little bit of light and help to those of us that are in the field with you.
Sure, I will
Like
just, I'll address that in a few words, and then happily turn to Sutton to talk about one of those research pursuits. Academic physicians typically have both a clinical portion of their work and a research portion, or in some cases, an administrative or a teaching portion of their work. So, none of us at a university are entirely and exclusively clinical practice.
Mm-hmm.
I have really a half and half appointment, and on the research side, my interest and desires have always been informed by my clinical practice. So I pursued research both in what's called clinical trials, which are, the way that we validate and confirm that a new intervention or therapy or drug is actually both effective and safe. So I do clinical trials, and equally important, I'd like to make sure that the work I do, both clinically and in research, is distributed equitably among all of the people that need the care.
Mm-hmm.
And the ivory tower has a long and not so great reputation of serving those who have the means to get there.
Mm-hmm.
And in our society, that is a very limited slice of the total population. So some of the research work that I and Sutton do is aimed at bringing everyone into the fold, especially those who have been, for one reason or another, excluded or underrepresented in research in the past.
I'm so glad you brought that up. We're going to do easy, lovely segues, because actually it's not a segue. Let's just continue on. But Sutton, I want to bring you into it because I think this is a perfect link. Thank you for the North Carolina Registry for Brain Health. I know just enough to know that this is probably a good time for you to tell us about your work and bringing in especially underrepresented groups and clinical trials. So.
Sure, thank you so much. And I'm gonna pop a link in the chat for those that are curious about my background, whichever way I'm pointing. So the NC Registry for Brain Health is a big arm of our efforts to increase the representation of North Carolinians in research to make it look like our state, and to increase the equity and inclusion of everyone in research. So not just one group is being involved in clinical trials, but everyone that is interested. So what the NC Registry for Brain Health does is twofold, which is education and outreach for research interest. We want to make people aware of the state of brain health here in North Carolina. It is a growing concern that dementia is going to be something that North Carolina is going to face more and more of as the years go on, mostly due to our aging population, but also due to some other factors. And we want to arm people with the knowledge and tools that they need to care for themselves and others as that time comes. So people don't know what they don't know. And part of that is we go out in the field and do community outreach. So I will be in Asheville this weekend at the Clear Health Fair, talking about brain health to people and hopefully bringing some resources to people who need it. We also do community outreach all around. So if you're interested, always reach out. And for people that can't go to where we're going or are too far away, we send out a monthly email blast with brain health tips about how you can improve your health. And once a quarter, we send out a newsletter with research findings. So we want to break down the wall between research and the community. And a big part of that is the paywall between reading the paper and understanding it, because some of the words are difficult. I have a thesaurus when I read. So we bring that to you in an easy, digestible way. It's fun and it's interesting. And we also tell you about what events are going on in your area. So when you're starting out that journey of caring for your loved one or figuring out for yourself what's going on, we bring those resources to you so you don't have to search as hard. And for people that want to get involved in research and affect the healthcare coming to them and their families, we can help you get involved as well. So if you ever meet the criteria for a research study, you may get a interest link emailed to you and saying, do you want to pursue this? If you say yes, then we help you get connected. If you say no, we say, okay, great. Thank you. You'll continue to get the free resources, and we leave you alone. And we understand that research isn't for everyone, but we encourage and would love for everyone to get involved. And going to also give you our most recent newsletter.
Ooh, thank you. And while you're doing that, I think this, first of all, I saw you all in action at the Dementia Alliance walk, and your lovely colleague, the Reverend Henry Edmonds from Duke, and another colleague, they had a whole tent up. And so for folks, if you don't know, go to ncbrainhealth.org. We're doing a PSA here, and I did it. Sign up. You sign up to be a part of the registry, no cost. And I had signed up years ago, but had an old work address. So now I re-signed up, and it's that way we can all do our part, because both staying aware, but also if you need other research people, we can join that.
Yeah. And one thing we also offer, because we know everyone doesn't have email or doesn't like it, and that's fair. We send out once a year a hard copy of our newsletters for people who either their email changed like yours, or if we know that you don't have an email, we'll mail it directly to you. But it's as what you want. We give you what you want, how you want.
Well, it's great. And I know that there's so much to be done that I get excited, and I had the pleasure of meeting some of your colleagues, and so it gave me hope to know that so many thoughtful people are working and there are advances, and so how we can learn about them. I'm gonna ask another question, and then audience members who are used to this, feel free if you have questions to throw into the chat. We have a loving competition in this part of North Carolina. I'm a Tar Heel. I wear Tar Heel blue, but apparently in the brain health and dementia space, there is a whole joint love fest going on, and so that is my smooth link to. Is it Dr. Bozoki? Do you want to talk to us about the Duke UNC Alzheimer's Disease Research Center, because it sounds like there's been a nice collaboration when it comes to research and practice?
I'd love to.
How's
And
that for my competitive opening?
yeah. So before I arrived, there were already plans afoot for a couple of years, ever since the new chair of our department at UNC, a researcher and clinical neurologist by the name of Gwen Garden, arrived. Her research and clinic focus has been neurodegeneration. It's similar to my own interest in dementia. And she partnered with similarly like-minded individuals over at Duke, persuaded our respective administrations that it would be a good idea for the two blues to connect, and would succeeded in a rather challenging hurdle of getting the National Institutes of Health to add us as a brand new Alzheimer's disease research center, adding to the then 33 programs that existed as the 34th. There are actually several other programs now in addition to our new one. But they're a group of centers around the country whose mission and focus is to learn more about Alzheimer's disease. And ideally, imagine a world in the future without Alzheimer's disease as a condition, or at least as one that is currently so poorly treatable. The position that I inherited when I arrived was the co-lead of one of the central pieces of the ADRC, which is the Outreach, Recruitment, and Engagement Core. So my task, along with that of several colleagues, and Sutton is one of them, is to educate the public about Alzheimer's disease, and in my case, to educate the primary care force of North Carolina, both to recognize and to know how to treat and take next steps in caring for people with cognitive decline, because I can tell you there aren't nearly enough behavioral neurologists. In fact, there aren't enough neurologists, full stop, in the United States to be able to care directly for the whole population with dementia.
Well, and I think the questions are coming in. So I want to ask a few of the questions that are coming in the chat line, because the first question that I'm seeing actually addresses that. My colleague Mary Bethel asked, it's hard for people to get appointments with neurologists. I think speaking to this lack of the numbers of staff. So if someone wanted to be seen by the UNC program, do they need a referral or can they make an appointment? So how do we get to meet with a neurologist?
Right. In order to fully answer that question, I have to interject something that's seemingly unrelated, which is that last year, around this time, the FDA approved a new drug for the first time. There is a compound that exists that in some people, in some cases, can help to slow the progression of Alzheimer's disease. So this was not only revolutionary in terms of its biology, but it really has upended the medical system because suddenly dementia, or at least Alzheimer's disease, turned from a chronic condition that you could treat whenever it showed up on your doorstep to something that became somewhat urgent to see and evaluate in a short time, because the window for treatment is relatively narrow. And so we have been inundated with referrals in a way that, our department, our division has never seen in the past. And because the university and our department had not ramped up in advance of this, we don't have 3 times the practitioners that we used to. We have an enormously long wait list, which I felt was so problematic that I actually have currently, until we get more people, restricted our referrals to those that are within the UNC health system. So the answer in part to the question of why is it so hard, why does it take so long, is that darn lecanemab. and the lack of hireable individuals within, the greater North Carolina metro, who can start to help us see this population quickly. We haven't ramped up as fast as lecanemab has.
Oh my gosh. Well, then, I know we only have a few minutes left because then I'm like, well, you need to, you know how the college students all have to read the same book at some point or it gets encouraged. Maybe the man, what is it? The man who thought his wife was a hat. Maybe you have to, since it inspired you so much, get the book out to more younger folks who are thinking
I
of
am going to primary care practices and clinicians and doing as much educating as I can of how they can handle
That was,
at
thank
least a
you.
substantial portion of the patient base
That
right
was my
now.
other question. Is there then, can there be a switch where it doesn't have to go through neurology? Can our primary care folks? All right, so that's good to hear. We're doing rapid fire questions. My colleague, the good Reverend Keith Steirolt asked, are either of you involved in any ongoing research about the intersection of spiritual practice and dementia? Ooh.
That is a really good research idea. I think that someone also cued that. I am not aware of any of our registry research studies being spiritual focused, but that doesn't mean that's not something that could happen sometime in the future.
Mhm.
We are also very specialized within the research world. I have no doubt that there are people who study that at Michigan State where I was. There was somebody who was studying that relationship, but I don't know of anyone down here right now.
Mhm. There's another, thank you. We're doing rapid fire. There's another question that actually I can answer. So if you can't, let me know, but I think you'll be able to answer it as well. And it's from my friend and colleague Charlotte. Brain health may be a family affair, as are most health issues. Are there LCSWs, licensed clinical social workers, available at UNC Geriatrics to work with families as a team together, parents, their adult children, not only for specialty diagnoses like Lewy body, um, I don't know PD, but in other disease states and are more subtle gradual declines, especially in older adults with their families, to assist aging in place as long as possible. I know them, but yes, do you want to do a shout out to the social work team with UNC Geriatrics?
The social work team at Geriatrics is fantastic. I'm trying to remember
It's
Brian
Brian Godfrey and
Godfrey. Thank you.
Jennifer
Yes.
Muse.
And I'd want to give a shout out to our very own social worker in our division who just joined us last month, Rachel Nagesh, who has already done some amazing work with some of our patients and stands ready to assist all who join the division and as patients and need the help.
And I think, again, it speaks to the wonderful interplay of the direct practice work, the research, and as Charlotte just brought up, the support for the whole family unit as well as the person. I do want to say, and I think that's our friend Mary Lou, who did the same thing I did right after talking to your colleague, just signed up for the brain registry. It's very easy to do. There's great information on the site. I do want to kind of wrap us up. I hate this, but you're now part of the coalition. I think I'm just telling you that now. You've already been great behind the scenes and helping with other events, and we want to continue these conversations. I do want to have a last question for both of you, which has been my I like to end on a positive note. I like, especially on a Friday, we want to go into the weekend with hope and positivity. So I want to ask each of you, what gives you hope for the future when you think about brain health?
Sutton, do you want to take that one first?
Yeah, I think so. And this is my personal experience from working with the All FTD study, which is a study I work with Dr. Bozoki on. The care and passion that I see from our research participants and their study partners is honestly humbling every day. And I think that the altruistic nature of our research participants gives me a lot of hope for a future cure because they're giving their all and we couldn't do our research without them. I think our research participants give me a lot of hope because without them, we can't do the work. And I think that the passion that they come every day to our study visits will lead to an eventual cure, and treatment in the meantime while we have that.
Thank you. Dr.
That is
Andrea?
so beautifully said. I don't think anything I say would top that. But if you're, asking, I'll give sort of an extension of that, and that is that the people who choose to research in this area, who are the scientists, have a similar sense of, incredible intense desire to make change. They are often people who have had family members or friends touched by this very common disease, and that was their motivation for getting into this space. And so they too have made huge inroads, and I see that we are literally just over the tipping point now with the first 3 drugs that have been approved. And literally there's a dozen more on their heels that are in late stages of development, at least a few of which are bound to prove successful and come into the market in the next 5 years.
Well, thank you to both of you. And the chat line is still blowing up both about the work of the there's Aging Disability Research of the Alzheimer's Disease Research Center and how you work with different universities around the state. So thank you for that. Thank you for sharing what gives you hope. I will share that in the last month, I've been able to meet 5 of you, 5 of your colleagues that are all connected with the ADRC and with the brain health. And you are the kindest, most thoughtful, most passionate people. And my brain is so happy to be enhanced with all of you. And really, thank you for all the work that you do. And may this be the first of many more conversations you have with the North Carolina Serious Illness Coalition.